Hello, I'm Dr. Arti Kandolkar. I'm a consultant psychologist and a counselor. Again, we are here with another topic called cyclothymia or cyclothymic disorder. This is a part of mood and related disorders, okay, which comes under bipolar and related disorders. So let's try to understand this. Okay, our previous videos have bipolar 1, bipolar 2, and this is the third one, that is cyclothymic disorder under, as I said, bipolar and related disorders. So let's move on. So cyclothymic disorder, we have to understand what does this mean. Okay, so a disorder marked by numerous period of hypomanic symptom and mild depressive episodes. Okay, so this is like hypomania is there. Okay, hypomania and mild depression. So it is neither mania, okay, nor depression. It is somewhere in between. This is, we know, is euthymia, normal mode. So it shifts between somewhere between here. Okay. So this disorder is characterized by a persistent mood disturbance lasting for at least 2 years. Now, as we know, mania is about 7 days, hypomania 4 days, depression is of 2 weeks and more. Okay. Now, this disorder, cyclothymic disorder, to identify the person is in the mild depression, it takes 2 years. So see how lasting it is. 2 years is a huge period. It's very difficult to identify these people in our environment. Okay, you cannot identify consistently on a even clinical setup to see that person for 2 years. Okay, so many a times these people are unidentified. They seems to be like they are moody, always sad. Okay, so but the criteria are this. Okay, for 2 years and 1 year for children and adolescents. For adults, it is 2 years, okay, and for children and adolescents, it is for 1 year. So that one difference is there. And the individual must not be without symptoms for 2 months. So now suppose there are 24 months. Okay, 2 months, a person may not feel the symptoms of mild depression. But 22 months are necessary, okay, out of these two. This disorder, although considered more chronic because it is longer duration, okay, but it is less severe. Okay, it is more chronic kind of a disorder, okay, but it is less severe because symptoms are experienced do not meet the criteria either for full hypomanic episode or depressive episode. Now they fall into a mania, hypomania, or any depression. Okay, they are somewhere in between. So we'll see this graphically as well. Okay, let's move on to the next one. Let's see DSM-5. Okay, DSM-5 criterias. At least 2 years. Okay. For 1 year in children and adolescents, there have been numerous periods of hypomanic symptoms and that do not meet the criteria of hypomania. So it is like mild mania, mild hypomania is there, but not in hypomania also. Okay. And numerous periods of depressive symptoms that do not meet the criteria for major depression. Now, usne depression, it has to meet, nor it has to meet the hypomanic symptoms. Now, where is it? We'll see this. During this 2 years period, 1 year for children and adolescents, hypomania and depressive period have been present at least for half of the time. An individual has been not without this symptom for 2 months in a time. So as I said earlier, 24 months is necessary for diagnosis. But in this 24 months, minus 2 months without the symptom is possible. Okay. Criteria for a major depression, mania, hypomania have never been met. If you meet the criteria for mania, it becomes bipolar 1. If you meet the criteria for hypomania and depression, it becomes bipolar 2. So none of this, mania, hypomania and depression, should be meeting. Otherwise, there will not be something called cyclothymia. Okay. So let's move on. Some more. D. The symptoms of in criteria A are not better explained by schizoaffective disorder. Now this is about schizophrenia kind of a symptom. Okay, so it is not because emotional instability, or it is because schizophrenia, schizophreniform disorder, delusional disorder, and any other specified or unspecified schizophrenia spectrum or other psychotic disorder. So you have to clearly understand whatever the symptoms which are coming in cyclothymia is not because of any of these disorders given. The symptoms are not attributable to the physiological effect of substance. Okay, it should not be because of any substance use or abuse. Okay, drug use, medicines, okay, or any other medical condition like hypothyroidism. As we know, mania can be created because of various factors. Okay, so similarly cyclothymia can be created because of many other reasons, so you have to exclude those reasons. F, okay, or sixth one, the symptoms cause clinically significant distress or impairment in our social, occupational and other areas of functioning, which is consistently in all the disorders. Okay, so let's move on. Now, as we know, cyclothymia is a mild mood disorder. Okay, it's not a severe, although it is chronic, long-lasting. It's a mild disorder. In cyclothymic disorder, mood swings between short periods of mild depression and hypomania and elevated mood. The low and high mood swings never reach the severity or duration of major depression or manic episodes. So it never reaches the highs of mania or lows of depression. The next we'll understand this graphically. Okay. See here I have given mania at the top. Okay. Mania at the top, depression at low. There is something called hypomania here and there is hypothymia here. Okay. This is mild depression. So this mania means, as you know, heightened mood. Hypomania means less heightened mood. Euthymia is a normal mood. Okay. Hypothymia means less depressive and there is severe depression. Okay. I hope this is clear. Now this euthymia is never meeting the criteria of hypomania or hypothymia, nor it is meeting mania or depression. So it is in between. It's a cycles. Okay. That is why it is called cyclothymia. Cycling between normal mood and slightly towards hypomania and slightly towards hypothymia. Okay, I think this graph will be helpful in understanding that. So now let's understand the summary of bipolar 1 and bipolar 2. Bipolar 1 is type of bipolar disorder marked by full manic and or depressive episodes. So there can be mania and depression. Okay, bipolar 1 can come with two. Bipolar 1 can have mania, okay, and can have mild depression or depression, but it is not necessary to have a depression. It's not compulsory. One episode of mania is enough to qualify for bipolar 1. Okay, and bipolar 2 is a kind of a disorder marked by mild manic, that is hypomania. Okay, here somewhere hypomania and depressive episode. So it marked between these two, hypomania and then. Okay, while bipolar means it's both mania and depression. Okay, so this is next is a difference between bipolar 1, 2 and cyclothymia. So just a summary. Bipolar 1 means one or more manic or mixed episode leading to serious problems or hospitalization and psychotic features. So bipolar 1 has to have mania. Okay. Second, it should cause serious impairment in your functioning. Hospitalization is necessary because it is like person in a heightened mood for around 7 days without sleeping, eating and doing things, necessary things. Okay. And there could be psychotic features in this. Bipolar 2, one or more hypomanic episodes. Hypomania is necessary for 4 days. Okay. and one more episode of depression, okay, which lasts for 2 weeks. So 4 days and 2 weeks are necessary. Here it is for 7 days, okay. And cyclothymia, altering between hypomanic symptoms and mild or moderate depressive symptoms. It doesn't mean a person have dysthymia or hypothymia, okay, sorry, hypomania, but it is like altering, just like the previous slide we have seen. It's just a cycle, okay, or mild shifting between normal mood towards hyper and depressive, okay, and less severe higher functioning. It's less severe than bipolar 1 and bipolar 2, but here the duration is less in this two, while here the duration is 2 years, okay, which is pretty high. This is hardly 2 weeks, 1 week, or you can say 7 days, 4 days, but it is 2 years to be diagnosed, okay. So we have already discussed about cyclothymia. I hope you have understood the difference between bipolar 1, 2 and cyclothymia, which comes into bipolar and related disorders. So if you liked our videos, please do subscribe, share and like our videos. Thank you.